So should overseas travellers to Australia be forced to take a COVID test prior to departure? And given the numbers still flying into the country, many epidemiologists are calling for a graded system of quarantine to capture the virus better and, of course, take the pressure off health resources at the moment. One of the key experts pushing for these changes is an advisor to the World Health Organization, Mary-Louise McLaws. I caught up with her this afternoon. Professor, can you tell us what needs to be done about quarantine moving forward? There have been suggestions about having a graded system, shortening the length of hotel quarantine, and a third suggestion today from the New South Wales Health Minister about people getting a COVID test prior to departing a country en route to Australia. What's your map of all of this and your sense of it?
So several of us have been agitating for tests before people get onto the plane, so that there are rapid antigen tests, and these are tests that take 15 minutes, so that if you do get tested at the airport, you'll probably have to get tested before you go through security, because if you turn out to be positive, you've got to go back home to wherever that is outside of Australia. Then once you test negative, then you go through and you get tested when you land as well, just to make sure that you're still negative. Then if you come from a low risk country such as China or Taiwan, Vietnam, then you might be able to go to the CBD quarantine hotels, because the quarantine hotels in the middle of a busy city is a recipe for disaster if we don't know whether or not the staff are negative when they go home every night. So you put in these rings of safety of who's coming in. You don't wait till day 2 to test them with a PCR that can take 24, 48 hours to come back. You don't test them at day 11. You test them before they even hop on the plane. You test them when they arrive. If they come from a low risk country, they can go into the CBD. And then, of course, you also test all the staff at the end of every shift, not just once or twice a week, because you can become infectious to others at about day 3, 4 and 5 after the staff become exposed but haven't got symptoms yet. And so this way they can go home and be safe for the community. Then what you can also do is shorten the stay potentially for those that are coming from low-risk countries. And so at the moment, if we test somebody at day 11 and they test positive, they've got to stay for another 14 days. So, but they could have been becoming positive from, day 3 after they had the test on day 2, etc., between, day 2 and day 11. But because they were only diagnosed on day 11, they then have to start the clock again. This way, you could use a rapid antigen test to test them maybe every second day for, up to about day 8, when people should start to get symptoms. If they're negative, do a PCR and let them go home, and they should be fairly safe for the community. I mean, actually very safe, because they've tested negative before they got here, negative when they got here, PCR negative on day 2, and then maybe day 4, day 6, day 8 again. And if they're negative, you are very confident that they can go out into the community. That way, you can have a turnaround for more people. Now, for those that come from higher risk countries, I prefer to see them in Darwin at an excellent facility in the Howard Spring facility for the international people coming back. It's run by experts in health emergencies. But if we can't do that, at least test them before they get on the plane, test them when they come in, and again, test them all the way through, every few days up to about, day 8 or so. And they too may be able to go home a little earlier. So there needs to be some epidemiology, some testing science, so that we can maybe free up some more hotel rooms and make it safer for the staff and the community.
Do you also envisage a time in 2021 when we go one step further in terms of safety and protocol, and we ensure that those who travel back or travel to Australia have actually had the vaccine before they depart?
that happening. And while it seems like a really safe idea, there are some caveats to it. So some of these vaccines, these ones that are being rolled out at the moment, you are protected against severe COVID, which is fantastic because the elderly are at great risk of severe COVID and potentially death. But you may not be protected from asymptomatic COVID. So you still may get COVID, you don't feel sick, and we don't know if you can pass it on. So yes, they can come in, but they have to be tested before they get on the plane and tested when they get here, and then potentially say, well, they've had 2 tests and they may be very safe to go straight home.
What are your thoughts on suggestions that we should be moving quicker in Australia to approve one of those vaccines? Because the US have now got approval. They're starting to roll it out. The UK is underway. We're probably going to get the best part of December to determine whether there are any side effects, etc. Is that not long enough? Should we not approve this in January?
I can understand that people are very anxious about this, and particularly we want to say this is very good for the elderly, preventing them having severe infection. We are going into the summer season. They will be at less risk, and I would like to see every single healthcare worker and carer at long care facilities all be vaccinated. So not just the front line, because don't forget, in aged care, every staff member gets to know somebody in aged care. It's not just their immediate carer. And the same in hospitals. You know, in Victoria, they have over 2,500 cases who are positive, who are healthcare workers, and they all didn't work at the front line. Now, they got infected for many different reasons, but I'd like to see everyone from the front door of the hospital to the back door of the hospital be offered a vaccine very soon to keep them safe. But we are actually at a level of close to elimination, and we are the envy of the world. So at the moment, our healthcare workers are very safe. Our elderly are very safe, but I would like to see them all vaccinated before autumn at least.